I'm Justin, and I did my presentation on hyperthyroidism. Hyperthyroidism, also known as overactive thyroid, is a condition where the thyroid gland overproduces thyroid hormone. The thyroid is primarily composed of tissue called follicles, and follicular atrophy or degeneration and complete destruction occurs. There are many different causes, most of which are autoimmune disorders, most common being Graves' disease. And in the photo below, you can see that large circular pink cells, that's the follicles. So Graves' disease is an autoimmune disorder which attacks and targets the thyroid, causing it to become superactive, working harder than it needs to, and overproducing thyroid hormones. This is very similar to hyperthyroidism, but doesn't always lead to it. Family history linked with this disease is an indicator for potential risk of hyperthyroidism. And in the picture below, you can see antibodies, which target the thyroid cells receptors, which causes the overproduction of hormones, which can lead to anxiety, tremors, bulging eyes, fatigue, etc. Risk factors. Due to the fact that hyperthyroidism is an autoimmune disorder, there aren't many risk factors contributed to being diagnosed with it. As stated, a family history of autoimmune disorders such as Graves' disease is by far the most common risk factor. In some cases, after a recent pregnancy, the mother can experience inflammation in the thyroid leading to hyperthyroidism. It is thought that during pregnancy, high HCG levels can possibly cause the thyroid to overproduce said thyroid hormone. The cause of hyperthyroidism and other thyroid-related issues has been linked to a specific mutation in the TSHR gene. This gene is responsible for making proteins that bind to thyroid-stimulating hormone, TSH. This gene is not linked to gender, but females are more prone to this disorder due to a more vigorous immune response found in women. So, symptoms of hyperthyroidism. Symptoms can vary based on severity, but usually include sudden weight loss, heart issues such as arrhythmias, irregular heartbeats, and tachycardia, which is rapid heartbeat. And large thyroid, aka goiter, shows up as swelling in the neck. Also, tremors in the hands. People can also experience vision problems due to a disease called thyroid eye disease, which is more common in smokers. Symptoms include bulging eyes, light sensitivity, double vision, inflammation, and pain in the eye. And as you can see in the picture, they show some of these symptoms, such as the bulging eyes, redness, and the eyelids retracting. So diagnosis. Diagnosing hyperthyroidism can be tricky since a lot of its symptoms are shared among a wide variety of other diseases. A physical exam and family history is checked, however, in order to get an accurate diagnosis, blood work needs to be done. These tests usually target thyroid hormone levels found in the blood to see if they are elevated, which could point to hyperthyroidism. And in this chart below, you can see different levels of thyroid hormones such as T4, T3, and TSH, and the significance to diagnosing hyperthyroidism and other thyroid-related diseases. Whoops. So for treatment, unfortunately, like most autoimmune disorders, there's no cure for hyperthyroidism. Treatment is different for everyone, but there are a few options that can help limit symptoms and reduce severity. Antithyroid medicine can be used to try and make thyroid limit production of the hormones. There's two most common in the US, that being methimazole and propylthuracil. Beta blockers can also be used to lessen these symptoms, such as tremors and heart palpitations. However, they don't lessen or limit the production of thyroid hormones. Surgery, also known as thyroidectomy, can also be done, but it's rare due to potential risks such as vocal cord damage. So hyperthyroidism and exercise. Exercise with hyperthyroidism solely depends on the severity of the condition. Individuals who don't have a good control of their disorder or aren't diagnosed can be in big danger if they exercise. On the contrary, however, people who are diagnosed and have control, exercise is more than recommended, but even encouraged. So the effects on exercise. Hyperthyroidism causes a decreased cardiovascular endurance due to high reliance of muscle glycogen. Increased oxygen consumption due to increased metabolism resulting in needing a larger oxygen intake. Severe cases can cause myopathy in the respiratory muscles, also known as muscle weakness. So my case study is a 35-year-old woman diagnosed with chronic hyperthyroidism. She currently takes an antithyroid medicine called tapazole to lower hormone levels. She is low risk as hormone levels haven't been spiking. She still requires clearance, however, to ensure her levels are still lower to decrease any risk to her health. Her goals are to increase and maintain bone density in order to prevent future muscle myopathy and weight loss. So exercise tests that can be done are to assess her aerobic capacity. We could do a treadmill walking test, such as the Bruce protocol, or through a cycle ergometer. Be sure to constantly monitor her heart rate and body temperature, since she can overheat and go to tachycardia. And then to assess her strength, we could do 1 rep max exercises targeting the core muscle groups, like you could bench for the arms, squat for the legs. And below is a graph of a sample Bruce protocol with lower stages than most people would do. And this would fit our patient, since she has hyperthyroidism and she isn't able to exercise as efficiently as other people. So exercise prescription. For aerobic prescription, we have her walk on the treadmill at 2 miles per hour for 20 minutes at least 2 times a week. And we can incorporate a 30-minute low intensity yoga session once a week in order to get the recommended hour or so of low intensity aerobic exercise she needs. And for our strength training prescription, I have her doing 3 sets of 6 of both bench press, deadlifts, and squats at 60% of her 1 RM twice a week. Total session time will be roughly 20 minutes, because the recommended for future success in muscle gain and bone density gain is roughly about an hour every 2 weeks. So some special considerations we have to look into when we design an exercise program for her are signs of overheating, such as excessive sweating and cramps, since hyperthyroidism can make it easier for someone to overheat. In order to prevent this, we can exercise indoors in a cool environment and make sure she has plenty of water so she doesn't dehydrate. We always need to monitor her heart rate so they aren't experiencing any kind of tachycardias where her heartbeat's really rapid and she could go into cardiac arrest or something like that. Also, we can monitor signs such as dizziness, numbness, fatigue, because these are potential side effects of the medicine she takes, tapazole. So in conclusion, most cases, as long as an individual isn't experiencing severe hyperthyroidism symptoms and is in control of their hormone levels, you should encourage your patient to exercise. There are many quality of life benefits from exercising to this disease, even if they're only a little. Thank you.